Well, we were having a fantastic year as a group of Rotarians, a lot of momentum, a lot of great energy, and then COVID-19 hit. On February 29th, the first death of COVID-19 was reported in the United States.
On March 13th, the President of the United States proclaimed a national emergency.
Today, we have over 1 million cases in the United States alone.
And over 65,000 deaths related to COVID-19.
As an event producer, my world has completely dried up. I've got no business for the next 6 months, probably, if I'm lucky.
It's affected my family. My children are no longer in schools.
One way or another, this is touching all of us in some mundane ways and in some very personal, real, and even painful ways. I learned that one of my dear friends, a professor, one of my professors passed away from COVID-19. It suddenly became very personal to me. It was no longer a number on a television screen. It was a very real number, 1. And I began to think, we have got to do something, and we have to do it fast.
As many Americans do what they can to protect themselves and their communities from coronavirus, Stephanie Sy reports on how people experiencing homelessness are uniquely vulnerable and what's being done in some states to help them through the pandemic.
Until COVID-19 came ashore, homelessness was the biggest epidemic in many U.S. cities.
I'm Reverend Andy Bales with Union Rescue Mission in Los Angeles. I'm the president and CEO. We've been through some very difficult times, but nothing compares to the pandemic, COVID-19 monster that we've been dealing with. We thought we were ready. It was the delay in getting the proper personal protective equipment.
I'm Amanda Green, Senior Director of Operations at Union Station Homeless Services, headquartered in Pasadena. At the beginning of the COVID-19 pandemic, Union Station took it incredibly seriously, and we started putting in measures before other organizations. And so because of that, we were able to have a small stockpile, but that small amount that we had on hand ran out incredibly quickly.
Nobody working on the front line of this pandemic should have to fight to get the resources they need. No hospital should have to fight to get access to PPE. No nursing home should have to fight to get access to PPE. And that just seems unacceptable. If we're asking people to be there to care for others through this pandemic, they should have access to the PPE that they need.
We knew that we needed to provide beyond just a regular mask to protect our staff and to protect those that we serve.
Having the proper equipment has been necessary. There has been a shortage.
So one of our members of our club, Jared Smith, found a way to address the need in our community to help our frontline workers, changing his 3D printing company to be able to print these face shield components.
My first year of college, I first started delving into 3D printers. Here in the middle of lockdown, I was asking myself, how can I help? I got in contact with USC Keck and asked, is there something that I can do to help you? And they were like, yeah, can you make 1,000 masks? And I was like hooked from there. I'm part of this amazing service organization, Rotary. How can I bring them in to help me assemble where I don't have a team that has enough workforce to actually assemble these masks?
So Jared began to put together a plan, pitched it to the Rotary Club, where he would create the components. Our members remotely would create some kind of distance assembly line, and they would work independently. So the project has several stages to it. The first is to produce 1,000 shields, and we've done that.
Really, that was an all hands on deck moment. Everyone wanted to help.
So today I'm picking up a box of face shields. I can assemble them. I'm actually gonna have my niece and nephews help me.
I'm going to be picking up 100 face shields, which I will be assembling with my husband.
When I saw the email and saw that they would allow my children to help assemble the kits as well, I thought it was a perfect opportunity for our family to be able to do something together to give back to our community.
What's great about these shields is that they can be reused. They can be easily disassembled in a simple way, disinfected, and then put back into service, and that's really important.
We are so incredibly grateful for the Rotary's donation of face shields. We had been looking at different providers, both online, overseas, in our community, and could not get our hands on face shields locally.
So it means the world to have people show up and support us. It means just even today, the boxes of shield. We can't thank LA5 Rotary enough. Friends like LA5 Rotary have made the difference. They're going to help us carry through and continue to make it through this disaster, and we will get through this together.
It's stunning how this club has come together. Let me do my best to sort of name the people who have been involved with this. I think of Russ Wittenberg of the foundation and all that he has done to lead us through the funding of this project. I think of Nancy Howard and her work with the legal team at Shepherd Mullen and making sure that the club and the user and everybody involved is protected legally. I think of Melinda Monterosa. I think of Christina Moses, of course Jared Smith, whose idea got this thing going. I think of Ken Chong, who's leading the selection committee. I think of Ana Rosales, who leads the service committee, and then of course Brenda Wewell and others in the LA5's care team. And it goes on and on and on. And I know I've left people out, but there are so many people who have their hands, their fingerprints, if you will, on this project. And that's a point of pride for me as the president of this club.
This project exemplifies Rotary values in the most pure and simple way. It's service above self.
Service above self.
Rotarians are people of action.
We are coming to a place to pick up a box, to take it home, to put these masks together to help people on the front lines who really need it.
Having a project that is so critically important at a specific time is what Rotary does best.
That is service above self. That is what we are doing. And it pales in comparison to what the nurses and the doctors on the front lines are having to go through. So I'm just glad that I can do a little something.